Coronavirus lasts in the body, air, clothes, and in food. How long? The novel coronavirus or SARS-CoV-2 spreads easily from person to person. Understanding how long the virus lasts in the body and how long it can stay alive on surfaces or in the air can help prevent transmission. This video explores the available research on how long the novel coronaviruses last in the body and how long it remains active in various situations. How long does coronavirus last in the body? The novel coronavirus or SARS-CoV-2 is the virus responsible for causing the illness COVID-19. Most people who develop COVID-19 symptoms improve without treatment in 2 to 6 weeks. However, this does not necessarily reflect how long the virus itself remains active in the body. COVID-19 has an incubation period, meaning it can be days before a person notices symptoms. In the case of SARS-CoV-2, a person can transmit the virus 48 hours before developing symptoms. Many people experience mild symptoms while some experience no symptoms at all. This can make it difficult to tell who has the virus. How long the virus lasts in the body depends on the individual and the severity of the illness. The Centers for Disease Control and Prevention (CDC) advise that people who test positive for COVID-19 should isolate themselves for the following amount of time, which is shown in the table. The figures represent when a person is most at risk for transmitting SARS-CoV-2 to others. However, the virus may remain in the body at low levels for up to 3 months after diagnosis. This may mean some people get a second positive test result even after they recover, although this does not necessarily indicate the virus is still transmissible. As of October 2020, there is no evidence that a person with mild or moderate symptoms can transmit SARS-CoV-2 more than 10 days after the first positive test result. How long do symptoms last? Early in the COVID-19 pandemic, health organizations advised that for most people, symptoms would last a short amount of time. However, since then, people have reported that their symptoms last much longer than this. A July 2020 CDC report found that 35% of people who had mild cases of COVID-19 are not back to their usual state of health 14 to 21 days after testing positive. Among those aged 18 to 34 years with no chronic medical conditions, 1 in 5 had not returned to their usual state of health. This suggests that for some people, COVID-19 symptoms last longer than original estimates. Even in mild cases, by comparison, over 90% of people with influenza or flu recover within approximately 2 weeks of having a positive test result. People who require hospital treatment or who experience long COVID may also have longer lasting symptoms. Long COVID or post-COVID syndrome is a name for a collection of symptoms that some people continue to experience months after their initial illness. The symptoms of post-COVID syndrome can include, but are not limited to, severe fatigue, trouble sleeping, shortness of breath, headaches, muscle weakness, heart palpitations, low-grade fever, trouble concentrating, memory lapse, mood changes, skin rashes, nausea or vomiting, diarrhea. Researchers are still examining what causes long lasting symptoms and how best to treat them. How long does the virus last on clothes and surfaces? A study from the New England Journal of Medicine investigated how long ACRS-CoV-2 would survive on various surfaces, including plastic, stainless steel, copper, and cardboard. The findings suggest that the virus could survive for 4 hours on copper, 24 hours on cardboard, 72 hours on plastic and steel. However, while researchers can detect ACRS-CoV-2 on various surfaces under laboratory conditions, it is unclear if this corresponds to a risk of infection under normal circumstances. A September 2020 study in the Lancet found that when researchers swabbed various surfaces in a major hospital in Italy, only one item of protective equipment tested positive for ACRS-CoV-2. They conclude that as long as people follow standard cleaning procedures, the risk of transmission from surfaces is low. How long does it last in the air? The study on surfaces also found that ACRS-CoV-2 could survive in aerosol form for 3 hours. An aerosol is a fine mist of liquid suspended in a gas, such as air. As the experiment ended after 3 hours, the total amount of time that ACRS-CoV-2 survives in the air could be longer. However, some factors such as air temperature and humidity may also play an important role. A June 2020 review notes that other coronaviruses survive for longer in colder, less humid air. This may mean ACRS-CoV-2 will become a more seasonal virus in some climates. The study on surfaces also did not consider how the virus might travel through the air in everyday situations. ACRS-CoV-2 spreads via respiratory droplets, which are tiny drops of liquid that enter the air when a person coughs, sneezes, or talks. A May 2020 study found that loudly talking can emit thousands of these droplets into the air, remaining airborne for around 8 to 14 minutes in a confined space. As speech droplets do not appear to remain airborne for very long indoors, a person's proximity to someone with ACRS-CoV-2 is an important risk factor for developing COVID-19. How long does it last in food? Currently, there is no direct evidence a person can contract ACRS-CoV-2 from food. The World Health Organization (WHO) stated that coronavirus need a live animal or human host to survive, and that they cannot multiply on food packaging surfaces. The World Health Organization suggests washing fruits and vegetables as normal and washing hands thoroughly before eating. People should also ensure that they do not share cutlery or plates with those who may have COVID-19. What to do if symptoms appear? If a person believes they have symptoms of COVID-19 or they may have been exposed to the virus that causes it, they should self-isolate in their home and call a doctor. Do not visit a healthcare facility without calling ahead first. According to the CDC, COVID-19 symptoms can include fever, cough, shortness of breath, fatigue, new loss of taste or smell, headache, body aches, nausea or vomiting, diarrhea. A doctor can determine if a person might have COVID 19 and if so, what to do next. If a person's symptoms rapidly worsen, they should call their nearest emergency department. Some signs of severe COVID 19 include trouble breathing, pain or pressure in the chest, feeling confused, inability to wake up or stay awake, blue lips or face, which may appear white or gray in people with darker skin.